Did you know that nearly 10% of the global population is affected by some form of liver disease? Shocking, isn't it? Now let's delve into the fascinating yet critical role of the liver. This powerhouse organ is not only crucial for detoxifying harmful substances, but also plays a pivotal role in producing proteins that our bodies desperately need. As we explore further, it becomes evident that the liver, when distressed, doesn't always send loud, clear signals. Instead, it might whisper warnings through less obvious channels, like your feet. Yes, you heard that right. Your feet might just be the unexpected heralds of liver health issues. Now imagine your feet not just supporting your weight, but also bearing the burden of signaling health problems, a role we seldom consider. From swelling to changes in color, your feet could be subtly hinting at underlying liver conditions. So, what if I told you that your feet might be the first to wave a red flag? Intrigued? Let's dive deeper. Ever noticed swelling, numbness, or a change in color in your feet? It might be more than just fatigue. Our feet are often the unsung heroes carrying us through our daily lives, but they can also be the first to signal when something is amiss internally, particularly with our liver. Let's delve into the signs. Swelling or edema in the feet and ankles is a common symptom that shouldn't be ignored. When the liver isn't functioning properly, it struggles to produce proteins such as albumin, necessary for regulating fluid in your bloodstream. Without enough albumin, fluid leaks into surrounding tissues, causing swelling. According to recent statistics from Google, over the past year, searches for foot swelling liver have surged by 30%, indicating increasing public awareness about this connection. Moving on to color changes, a purplish hue on the feet, known as cyanosis, can occur. This is when there isn't enough oxygen being delivered to the extremities. Liver disease can impair blood flow and oxygen delivery, making cyanosis a critical sign to watch out for. Severe itching of the feet is another symptom not to be overlooked. This can be due to bile salts accumulating in the skin because the liver, which normally helps to eliminate these salts, fails to do so effectively. PubMed cites several studies showing that patients with liver dysfunction often report itching as one of the earliest symptoms. These signs are not just discomforts, they are your body's way of signaling potential liver issues. Ignoring these symptoms can lead to more severe health problems. It's essential to listen to these early whispers of distress from your liver. Remember, the health of your feet can reflect deeper issues, such as those affecting your liver. Observing and responding to these symptoms promptly by consulting healthcare professionals can make a significant difference in managing and potentially reversing liver damage. These symptoms might seem minor, but they can be the early whispers of a liver crying for help. Catching liver disease early can be a game changer. But what is the first stage of liver damage? The liver, an organ that works tirelessly to filter toxins, can be subtly undermined by those very substances it tries to protect us from. The initial phase of liver damage is typically marked by inflammation. This is where the liver starts to swell and become tender, a direct response to injury or infection. It's an alarm system, indicating that all is not well. Inflammation is the liver's way of trying to heal itself. During this stage, cells within the liver enlarge, causing the organ itself to expand. This can sometimes be felt as a mild ache or fullness in the right upper quadrant of the abdomen. However, many individuals might not feel any discomfort at all, which is why this stage often goes unnoticed without specific tests. Interestingly, the signs can sometimes manifest in less obvious ways, including changes in the color and condition of your feet. Swelling, a subtle texture change in the skin, or even a shift in temperature might all be indicators pointing to liver distress. By connecting these dots early, individuals can seek medical advice and potentially reverse the damage through lifestyle changes and medical interventions. The key is to be vigilant and responsive to these subtle cues. The earlier you catch it, the better your chances of reversing the damage. Remember, knowledge is power. Now, knowing what harms your liver can be just as crucial as recognizing the symptoms. Among the greatest threats to liver health is excessive alcohol consumption. It's not just about the occasional drink, but rather the chronic and heavy intake that bombards the liver, forcing it to work overtime. This relentless assault can lead to conditions like fatty liver, hepatitis, and cirrhosis. In fact, studies show that heavy drinking is the leading cause of liver cirrhosis in the United States. Then there's the modern diet, heavily laden with processed foods and sugars. These aren't just bad for your waistline, they're a nightmare for your liver. High fructose corn syrup found in many sodas and packaged foods is particularly villainous. It's metabolized directly by the liver, fatiguing it, and potentially leading to a dangerous buildup of liver fat. This can escalate into non-alcoholic fatty liver disease, which now affects up to a quarter of the global population. Lastly, certain medications can inadvertently wreak havoc on your liver. While they're formulated to help, some medications contain elements that can be toxic to liver cells when used excessively or improperly. Pain relievers like acetaminophen, when taken in high doses, are a common example of drugs that can cause acute liver failure. Steering clear of these can be your liver's best defense. Let me tell you a motivating story about John Doe, who noticed his feet swelling and took action. John Doe, a 45-year-old software developer, had always prided himself on his ability to handle stress and long hours at the desk. However, he began to notice something unusual. His feet were often swollen after a day's work, something he initially wrote off as just another sign of aging or perhaps too many hours seated. But as days turned into weeks, the swelling didn't subside. Instead, it worsened, accompanied by a noticeable change in color. Concerned, John finally decided to consult his doctor. After a series of tests, the results were somewhat unsettling. John was diagnosed with early-stage liver disease. This diagnosis came as a shock. John was neither a heavy drinker nor did he engage in any of the typical risk behaviors associated with liver issues. However, his diet was rich in processed foods and his lifestyle was sedentary, two significant factors that contributed to his condition. Determined to turn things around, John embarked on a rigorous journey of recovery. He revamped his diet, eliminating processed foods and incorporating more fresh fruits, vegetables, and lean proteins. He also began a regular exercise regimen, starting with gentle walks that eventually morphed into a consistent routine at the gym. John's commitment extended beyond just physical health. He attended regular sessions with a healthcare professional who specialized in liver diseases, received guidance on managing stress, and regularly monitored his liver function with his medical team. This proactive approach allowed John to manage his symptoms effectively and halt the progression of the disease. Months into his new lifestyle, the changes were evident not just in his physical health, but in his overall well-being. The swelling in his feet subsided, his energy levels improved, and he felt more vital than he had in years. John's story is a testament to the fact that with the right steps, recovery is within reach. His experience underscores the importance of listening to our bodies and acting swiftly upon noticing signs that something might be wrong. It's a powerful reminder that when it comes to health, being informed and proactive can make all the difference. We've journeyed through the silent signs to actionable knowledge. Are you now more attuned to what your body, and specifically your feet, might be signaling about your overall wellness? Today, we delve deep into the fascinating connection between our feet and our internal health, uncovering how they serve as a reliable gauge for potential health issues, notably those related to the liver. Swelling, color changes, or an unexpected texture in your feet are not mere coincidences. They are, in essence, subtle alerts from your liver, indicating that it might be time to take a closer look at your health. Why focus on the feet, you might wonder? The answer is surprisingly straightforward. Your feet are often the first body part to show visible signs of distress because they are farthest from your heart, meaning any circulatory or systemic issues manifest there initially. For instance, a bluish or reddish hue might indicate circulatory problems, which are sometimes linked to liver dysfunction. A puffy or swollen appearance could suggest that your liver isn't processing fluids or toxins efficiently, leading to retention and swelling. Ignoring these signals is akin to turning off a warning siren that's endeavoring to protect you from potential danger. It's vital to listen to these warnings. If you have observed any peculiar changes in your feet, or if something seems off, it is imperative not to delay. Consulting with a healthcare professional should be your immediate next step. They can provide valuable insights into what these physical changes might mean and guide you toward the appropriate next steps for maintaining or improving your health. Early detection and intervention are crucial. They can profoundly influence the course of potential health issues, making a significant difference in outcomes. Remember, your body is constantly communicating with you, and it's essential to listen intently and respond thoughtfully. And now, we'd love to hear from you. Please comment below with your thoughts or personal experiences related to liver health. Thank you for watching. If you found this video informative, please like, share, and subscribe to Facts Academy 0122. Stay healthy and stay informed.